We'll call this meeting to order of the Board of Directors of the Sacramento Metropolitan Fire District. Can we get the roll, please?
Yes. Director Sailors.
Present.
Director Stark.
Here.
Director Weber. Here. Director Wood.
Here.
Director Costa.
Here.
Director Clark. Here. Director Jones.
Here.
Directors Gould and Rice are absent this evening. Thank you.
Thank you very much. Director Sailors, would you lead us in the pledge?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. We'll move on to the Metro Cable announcement. This meeting is being recorded. The recording will be cablecast on Metro Cable Channel 14 on the Comcast and DirecTV Uverse cable systems. The recording will be closed captioned and video streamed at metro14live.saccounty.gov. Today's meeting replays at 6 o'clock on Monday, the 15th of September, and again at 6 o'clock on Wednesday, September 17 on Metro Cable Channel 14. The video will also be available at youtube.com/MetroCable14. Now is the opportunity for members of the public to comment on items on or not on the agenda. Do we have any speakers?
Yes, I have one speaker card from Roger Mitchell.
Good evening, Mr. Mitchell.
Board Chair, Mr. Wood, directors, chief, staff, and public. My name is Roger Mitchell, and I come tonight before you with a great thank you. And so I make sure I get this right. I'm going to read what I've read about this. So I don't like reading in a situation like this, but forgive me so I don't make a mistake and it works well. So I would like to thank Mark Nunez, our public information officer, for putting together the open house at Rio Linda Station 111 to honor Rio Linda's first fire engine, Old Betsy, with her 100-year plaque provided by the Horseless Carriage Club of America. Would also like to thank directors that were there. Cindy Sailors. Would like to thank Director Wood and entire family. And Director, I have it written down here, not Weber. Thank you, Mr. Director, for the correct. Deputy Chiefs Tyler Wagaman and Joe Farica. Also Mark Siebert, head of the logistics with the Reserve Firefighters Group. Also the CERT Group and Community Relations, Station 111's crew for hosting this event, and all Metro staff for making this event such a success. Also, Ed Rose for displaying his 1913 Model T, and Lynn and Jenny Kissel for displaying their 1914 Kissel, both clubs from the Horses Carriage Club of America. So it was a great event, and I thank everybody for their work. Couldn't have done it certainly without your public relations officer. Those of you that were there, I think you would agree that it was a wonderful event. And with a little bit of fun here, Director Woods, I think the family was talking about the jail that will be at our public relations, our fundraising dinner. And I had a comment after that from someone that knows. They said, you know, there's room in that little jail for the whole family, 3. So anyway, but I'm here to thank Metro Fire as a whole. That was a wonderful event. And I'm here to answer any questions, or if you want a comment or whatever about that, would be happy to do so.
Do you have any comments or questions for Mr. Mitchell?
I do.
Director Weber.
Yes,
We had
Director.
a lot of independent little newspapers there. Do you know if that's going to be in any one of those?
I've been interviewed twice. I've been told there's going to be something in a local paper, but I've also been told that they want to wait until after our fundraising dinner so they can see that the process of raising funds to restore the Rio Linda second engine. So I'm not sure when it'll come out, but when it does, I'll try to grab as many of them as I can so I can get them to the board.
Thank you.
So you're entirely welcome, Director.
You mentioned something about the fundraising dinner. Before that, there's going to be an opportunity to go see the progress on.
Yes, sir. What we have attached to each ticket, some of the people that normally come have said, you know, we've never seen the truck and how it looks now. And so what we've done is there will be a couple of people at the old station, which is literally a couple hundred yards from where you eat. And that's going to be opened at, I believe it's 3 o'clock till 4:30 or so. And there'll be a couple of people there to explain everything that's going on. I won't be there. I'm going to be busy down at the dinner. But and I have to admit, I'm sorry to tell you this. If you don't have your ticket, I'm sorry, we're sold out. So I apologize to the ones that don't have them. But I guess it's a good thing to be sold out. So, but, and you're also welcome to come anytime. If you let us know anytime you want to come and look at that restoration in progress, you're always welcome. So just let someone here in the department know to get a hold of me, and we'll make every effort to be there, even if it's days we don't work. So anyway.
Thank you. Any other comments or questions? All right. Thanks again. Look forward to
Thank
seeing
you,
on the
Director.
4th.
Those of you online on Zoom, if you have a public comment, please use the raise your hand feature. No other public comments. Thank you.
Thank you very much. Moving on to the consent calendar, do I have any questions on the consent? All right, I'll entertain a motion.
I'll make the motion, please.
Got a motion from Director Weber, a second from Director Stark. If we can get the roll, please.
Yes. Director Saylors.
Aye.
Director Stark.
Aye.
Director Clark.
Aye.
Director Jones. Director Weber.
Aye.
Director Costa.
Aye.
President Wood.
Aye.
Thank you. Motion passes. The consent calendar is adopted.
Thank you. Moving on to presentation items, CFO O'Toole, good evening.
Good evening, President Wood, directors, Chief Mitchell, colleagues, and members of the public. Tonight, I will be introducing an emergency medical services fee study presentation that will explain how the district's fees match up with actual costs and similar agencies. Completing this study has been a district strategic objective, and last year the district commissioned NBS, a firm specializing in local agency fiscal consulting and fee study services, to examine EMS fees. You'll hear more about this shortly, but to offer a headline, the district does not collect more than it costs us to provide EMS services. In fact, if the board wishes to explore it, there are opportunities to modestly improve collections. For example, the study includes new cost service information related to mobile integrated health that we haven't had before. So with no further delay, I will introduce Nicole Huerta from NBS. She will present the report, and her colleague Nicole Kissam will be participating remotely to answer questions.
Thank you, Dave. Members of the board, good evening. Thank you for your time. Okay. So as Dave mentioned, I am with NBS Government Finance. We are an independent consulting firm that works with special districts, cities, counties, and other municipalities to understand the costs that go into you all providing the services to your communities. And we dive into the weeds so that we can then present information to you all so that you can get a clear picture of how your costs calculate into fees, and also so that you all can get a clear picture and understand that the fees that you have set, or if you intend to set certain fees, that they do not exceed the cost of services, which is an important component of conducting fee studies. So should I hit enter for the next slide, or is there a... got it. Thank you very much. Okay. So for the presentation agenda, there are 4 points here. These 4 points are essentially going to cover what we're going to discuss today through the presentation slides. The first is project goals. So the point of the project, we're going to talk about that briefly. We're going to talk about the project approach, the approach that we used to study the cost of services and get to a place of understanding the fees that align with those costs of services. We're going to talk to you all about the summary of the results, and we're also going to open it up for questions afterward. Okay, so when it comes to the project goals, a main goal of this project was to understand the total costs of providing services. So these would be EMS-related services. We understand the fire district provides other services, but particular to this study, we studied EMS services and ensured that we did not include any costs that are related to non-EMS services. That would be fire prevention, for example, or hazmat. Those types of costs, we ensured that those were not included as a part of this. They were from a holistic perspective, meaning the total costs that are incurred by the district are mentioned in our study. However, there's an element of our study that mentions the costs that really are specific to the EMS portion, and that's what we're going to cover today. Another goal is we wanted to ensure that the fees do not exceed the cost of providing services. The last goal of conducting the study, we wanted to provide an opportunity to you all to evaluate the fees and determine if there are adjustments that you all would like to make based on the EMS proposed model that the district adopted back in 2023. For the next slide, we have our project approach. So our projects, when we're doing fee studies, we tend to go through 4 steps. The first being the cost of service analysis. So when we are approaching a study and doing a cost of service analysis, we are looking to understand what it takes financially to provide each service. And a critical component of this is we are analyzing direct and indirect costs. So these are not just staff that would be on an ambulance, for example, providing services on scene. These are also administrative staff that could be assisting with the provisioning of EMS services. So these are staff that could be in finance, for example, or it could be a staff member that is directly associated with the fire department, maybe in a suppression division that does have some administrative related duties that are tied to EMS services. When it comes to fee establishment, that's mark number 2. We established the maximum cost per service based on the expenses that we saw within the report. What I mean by maximum cost per service, so we are establishing the cost that is essentially the ceiling that can be charged for transport, for treatment on scene, and for any other core service that the district provides. For number 3, cost recovery evaluation, when we look at cost recovery, we are looking at costs that are being covered by the fees. And another component that I mentioned briefly before when it comes to cost recovery that's really important is the study has to take into consideration that there are costs that have to be excluded from the study because they may not be EMS related. And specific to ambulance-related fee studies, what we find is that we have to take into consideration that there are caps. What I mean by a cap is there are caps to payers that are CMS regulated. What I mean by that is Medicare or Medicaid regulated, or there's also private insurance caps. There are also payers that have private or no insurance. So depending on the types of payers that are being serviced by the district when it comes to these EMS services, there is a very strong likelihood that even though there is a cost of providing that service, the district is likely not going to see that full cost reimbursement because of those caps. So that's something that's really important to remember when it comes to this kind of study. The last piece is the comparative fees survey. So the comparative fee survey is something that we do to give a visual of neighboring jurisdictions. In this case, we actually went a bit beyond the neighboring area to give a picture of how fees are being charged or what they're being charged in terms of what's being charged for transport, what's being charged for treatment on scene. And we also we tried to find agencies that are charging what seems to be newer in the state called mobile integrated health. We understand there's a mobile integrated health program or a service that the district has been looking into or been trying to get into service. And in order to do that, we just like to show if there are any other agencies that are already doing this, but from what we found, it's very, very minimal. There are articles about other agencies that are considering it, but from the standpoint of it being in practice, Sac Metro is one of the first. For the next slide, for key data sources. So We used 5 key data sources in terms of doing the analysis for fees. The first, we used the fiscal year 25 adopted budget. We also used annual billing data. But the billing data would have been for fiscal year 24. The calls for service data would have been also for fiscal year 24. We looked at the current fee schedule to see where fees stand today. And we considered the district's EMS service delivery model, since that structure essentially drives how costs were studied within our report. On the next slide. So this is a slide that shows the cost of service on an annual basis, meaning there's a total costs that's mentioned on this slide of $309 million. That is the district's total costs, meaning when we take the budget that is allocated in order to provide services to the community, the total is $309 million. However, the study shows that out of that $309 million, $213 million are EMS related. So in determining how to spread those costs, in using the calls for service and in using staffing models and vehicles, how vehicles are dispatched to calls, using the EMS, the updated EMS response model, we were able to come up with costs assigned to each of those types of units that respond to EMS calls. So the cost element over to the left lists the different types of costs. So there would be labor, recurring non-labor. Recurring non-labor are just some of those operations-related expenses, like maybe some of those contract costs or equipment-related costs. Then there's district-wide overhead. So district-wide overhead is the component of other departments that spend time or have functions that are directly related to having support applied to suppression or to the EMS divisions. What I mean by that is human resources, for example, the finance department. Those are all groups, while they are separate from the EMS division or the suppression division, they still have a component in ensuring that the EMS program or the EMS group is able to have all of their staffing needs met, have all of their training needs met, so on and so forth, all of their certifications required by the state in order for the calls to still have, to still be responded to and have all of the certifications needed in order for staff to continue to respond to those calls. When we get down into the section that says EMS response $213 million by vehicle type for fee analysis purposes, this is essentially the summary of the table that's saying that we did a study by vehicle type for the fee studies purposes. And the vehicle type, the reason we chose that method is because the EMS response model is very specific to which vehicles will respond to which service types within a geographical area. For the cost of service analysis per fee slide, so here we're mentioning the fees for service that we analyzed. And the 2 fees that were already present before we started the study were transport and treatment on scene. The 3 additional fees that we studied are EMS service, which would be from 911, MIH service from 911, MIH follow-up service, and then there's supplemental transport. We'll get into those definitions in just a couple of slides. So the cost of service analysis per fee slide mentions that there are pieces of information that we used to go into, that went into our cost of service analysis in order for us to get to a place where we had a distribution of costs by type of service for each of those vehicles. The first is we looked at the average time for each responding vehicle by using the calls for service information that was provided. The second, we considered how long the call lasted, each of those calls, what type of vehicle responded, and how many personnel were assigned to each vehicle. The reason that's important is because an ambulance, for example, has 2 personnel, an engine has 3. Could be 2 firefighter paramedics and a captain, or an engineer and 2 firefighter paramedics that are providing EMS-related services on the scene. There could be a truck that's also providing EMS-related services on the scene. However, the truck, instead of having 2 or 3 staff members, they could have 4. They should have 4 staff members. So including the number of personnel on each of those vehicles as a part of the cost of service is something that we consider to be a critical component. Finally, Distributing the costs across the different service types allowed us to get a clearer picture of exactly how much each vehicle is costing in terms of when they respond to each of the calls and the impact that they have, the financial impact that they have for each of those incidents. This next table is a distribution of costs per response truck or response vehicle. So it's the MIH vehicle, the squad, medic unit, engine, and the truck. This is showing on a line-by-line basis what the total cost per service is. That's totaling up to that 213.3 million figure that we saw on a previous slide. It's also giving you a max cost per service. So something to remember, to consider about the max cost per service is this is the maximum or the ceiling that can be charged. When it comes to the amount that would actually be charged is completely up to the district. That would be a policy decision. But our report just identifies the maximum amount, meaning this is the amount that that is the ceiling or the limit of charging per service. A couple of observations from here is that there's a variation of the maximum cost per service for each of these types of services. For transport, transport carries a higher maximum cost per service because each service type requires a greater resource commitment compared to other response types. Also, close to the transport figure that is coming out as a max cost per service is the MIH service from 911. So this is actually something that would be considered a new fee since the district is looking to build out the MIH service. MIH also carries a higher maximum because of the service type requires just a greater resource commitment compared to other response types. However, getting into treatment on scene. So treatment on scene has a lower max cost per service because those incidents are resolved without a transport and they don't incur those offload times or those transport related times, meaning from the scene to the hospital. Those are not costs that would be incurred on this type of incident. So that's why that cost is a bit lower than you see for the transport amount. And then the MIH follow-up is something else that's newer. The MIH follow-up is for in-home or on-site visits conducted after an initial 911 encounter. And then there is the supplemental transport, which pertains to scheduled or like lower acuity ambulance transports that do not originate from a 911 call. So those are a different type of ambulance, different type of medical apparatus that would do the transports for those individuals, but not something that would come from 911 dispatch. Go back.
Yeah, sorry to interrupt. I have a quick question. Can you just confirm offload time again? You defined it.
So when there is a patient that is being transported and the ambulance gets to the hospital, they can't always just drop off the patient.
Right.
They have to wait until the patient is able to get service or be seen from a member of the hospital, and that is what we mean by that offload time.
Just wanted to confirm, so we do take that into consideration when we guide with that. Okay,
Absolutely.
thank you.
Mr. President, I have a question on this slide, if I may, please. Thank you for all this attention to detail, especially the parsing out of the hours for the MIH versus an ambulance 24/7.
Right.
That's, I appreciate that. This canceled en route number on page 8 jumps out at me for MIH. Can you tell us what's going on there?
So in the calls for service data, whenever there is a vehicle that is identified as an MIH vehicle, then, and there happens to be a call that was canceled, but it was MIH specific, then that is the amount that we identified under canceled en route, which means that those are costs that cannot be recovered. The MIH vehicle in fiscal year 24 came up in the calls for service in the 911 dispatch. I believe this was when the district began testing MIH, but there were still MIH-related calls within the 911 system, but not necessarily deemed MIH, just an MIH vehicle.
Well, I'd like to follow up offline on that number. Sure. Thank you.
I have a question too. Start. Regarding the MIH, I'm sorry, I'm new, so I'm learning a lot of this. It's, I believe that the MIH is covered, you said, or I've heard, by a grant at this point. So that'll be for approximately 2 years. the grant?
And it'll run out at the end of next year.
Okay, and so it's approximately, if you add those two up, it's approximately $2 million. Is there anywhere in this study that reflects the money that we're saving by sending out the MIH to help, balance the book, as it were, to show that we're actually saving money by not having to go to other calls? I know there's been some studies of that, but is it reflected anywhere in this report?
So under total service cost on this slide here,
Yeah.
if you go 4 rows down to MIH follow-up service, and under the total service cost, that's coming up to about $800,000. It is a substantially lower cost than if a designated MIH vehicle were doing a similar response, but having that response being grouped under a different type of service. So calling that out separately is important in order to identify the costs and the fee that would be associated with it.
I would just like us to track that going forward. I mean, if we are saving a significant amount of money from using MIH, which I believe we are, just that that's somehow reflected in the report. Thank you.
Thank you. Okay. On this next slide, current fee versus max fee. So I know it's kind of small, but essentially what we tried to show here is that while we did our calculation for what the max cost of service would be, meaning the maximum amount that could be charged for each of the types of services, we also wanted to show what that looks like compared to the district's current fee. And one component on this slide that I want to call out is over where it says current cost recovery percentage. For transport, it's showing 102%, but it's important to note that 102% does not indicate an over-recovery. So what's happening here is we are reallocating costs or reallocating a portion of those costs into the new categories to support Metro Fire's evolving EMS response model. So with taking costs and how they would have been classified using a model that does not have MIH services or supplemental transport, for example, by ensuring that we now break out costs to identify specifically for those new fee types, there's a shift of the cost that's occurring that essentially makes it look like there's an over-recovery, but there actually is not. So that's something I just wanted to point out, since I understand how that could look like there is, but that's actually not what's occurring here. A couple of other points to call out. When it comes to the treatment on scene, so treatment on scene is something that's showing it's recovering about 22% as of right now, the current fee versus the maximum cost per service. But this is a typical finding when we do these fee studies. We see frequently that the cost of providing treatment on scene tends to be higher than what agencies are charging out, and from our experience, that's usually based on a policy decision. However, we just wanted to call out that we understand that a $2,000 treatment on scene fee is something to understand, that it's just because that's how the costs are laid out based on the types of services that are being rendered on the scene. The added fees of MIH for MIH from 911 or MIH follow-up, along with supplemental transportation. So these are, like we mentioned before, these are new fees if you all were to establish them. These would be fees that would be added to the fee schedule. When it comes to the add-ons at the bottom, so the add-ons were not studied as a part of the study. Since add-ons are situational or essentially they vary case by case, there isn't a consistent pattern across all patients. So they're really hard to study in a cost of service model. And the focus here was on the core services like your transport, treatment on transport, your new fees if they were to be established at a later date, which would be MIH or supplemental transport. And then getting into the summary of the results. So as I mentioned earlier in the presentation, so Dave also mentioned that the district is billing the costs that are being incurred. there is no instance of over-recovery. However, the district currently recovers about 30% of the costs of providing services. That 30% is directly related to billing instances for payer mixes, like those Medicare or Medicaid write-downs, those private insurances that might have a contracted cap that they are permitted to reimburse. There could be patients that don't have insurance and it ends up being a write-off. There are various reasons why the billed amount does not come in to be the same when you get to the collected amount. So with that being said, the annual charges based on the current fees are billed at about 210 million. Collected, though, is only 64 million as a result of all of those write-downs or all the write-offs. And as far as the estimated cost of providing the services conducted or identified when we conducted the study, 213 million could be recovered or could be billed, but collected, only about 65.8 million of that would be collected, considering the 30% collection rate. And we mentioned before when it comes to the comparative survey, so these are all of the agencies that we used to compare the district's current fees along with the max fees that we deemed or that we calculated as a part of the study. And what we found is that there are instances of comparison for transport and treatment or transport. When it comes to the transport fee, it is within the range of the agency studied and also within the range of the average of Sacramento County EMS agencies. Treatment on transport, there are less agencies that charge that amount. However, for the ones that do, the district's fees are higher than those. But as I mentioned, the max fees would be higher than those. But as I mentioned before, there could be reasons why the treatment on scene fee is adopted at a lower rate than what is included in the study. And then the other areas that we noticed pertain to MIH and supplemental transport. There aren't any other agencies that we were able to find that are actually charging these fees at this time. So Sac Metro would be the first or one of the first. And then when you get into those add-ons, so while we didn't study those, we did take a look at how other agencies are billing them. And the district is very, very close to how all of the other agencies are billing those fees. And I will open it up for questions.
I have one.
Sure.
Back to slide 9, and it might be Chief Perry's answer, but is this treatment on scene, is that relatively new? Is that something that we recently started doing? 'Cause in 17, we discovered that Medicare code existed, and I didn't think we were billing for that before then. So is that one of the reasons why we're so low on that?
Or
Anybody has an
treatment on
answer?
scene or MIH?
Treatment on scene, because there was a treatment not transfer
Right.
Medicare code that wasn't active at the time, and I don't know if that ever got activated, but I'm just trying to figure out why we are only at 502, why we're recovering 22%.
So to differentiate, the treatment on scene is more in regards to, think of an individual that has a diabetic emergency. They call 911, our amazing crew gets there, gives them sugar. They wake up and they say, I don't want to go to the hospital. That'd be a treatment on scene by one of our crews. MIH, 911 call or treatment services like we're doing more advanced things, prescriptions and things of that nature. So that's why there's a differentiation between like the paramedic treatment versus the MIH treatment. And so there's no cost comparison for as the MIH side because it hasn't been done before. And so this is the first of its kind.
All right, that makes sense. Director Sailors, thanks so much, Chief. Director Sailors?
So the treatment on scene, that $502, is that otherwise known as our first responder fee?
Yes.
Thank you.
Director Weber?
So same slide, mileage, oxygen, night charge, cardiac monitor. You had mentioned that this is not part of the study, is that correct?
So the costs are a part of the study, but the actual fees being charged now, The costs are a part of the study from the perspective of they are included in that $213.3 million number. But in terms of determining how to charge for each of these add-ons, with the exception of mileage, I know that the mileage has a dollar amount. But when it comes to the other three add-ons, we didn't, because they vary so much when it comes to doing the study and incorporating those types of fees, it's too large of a variable to be able to ensure that we're nailing down the correct fee to charge. But what we did notice is that the fees that are being charged by the district are in line with what all of the other agencies are charging, even the ones outside of your neighboring area. So they made sense to us. Nothing jumped out as out of the ordinary.
Well, my specific question is night charge. Why do we have a night charge? I mean, we don't sleep, so can you explain that to us?
The night charge?
Director Weber, it's policy driven per the last EMS fee study that is adopted by the board, and so that's why it's in there, frankly. It's something that the reason of doing this study was to bring it up to a current standard of how we're delivering the EMS system.
So are we charging a night charge currently?
Currently, by the EMS policy.
What is the rationale behind that?
I can't recall the direction given at the last adoption of the policy, frankly. We can look into it.
Day call, night call. at all.
Yeah, we can look
So-
into it.
Thank you.
I have another question. Director Stark. On slide number 8, when it's talking about supplemental transport, is that referring to inter-facility transportation?
Yes,
Like moving the patient from one to another
hospital
location?
to facility, facility to facility, sure.
Is that something that this department does, or is that something that we have our private partners do?
It looks like I can see that happening in the calls for service. It could be both. Is that the third-party provider? Oh, sorry, go ahead.
Yes, occasionally we'll transport from hospital to hospital. Think of like an inter-facility from like let's say a stroke goes to a certain hospital and they need an emergent transport from one to another.
Yeah.
That's when, and there's no private ambulances available, they'll contact us. and we'll
I
get-
understand. I understand the inter-facility. I just didn't realize that we did that. I'm just learning. Thank you.
Rare
Thank you very much.
circumstances.
Director Jones.
Yes, thank you. I'm a bit confused on some of these things. It says max cost per service.
Yep.
Now, who or how is it that the cap is decided there, and does that reflect the full cost against throughout all of our divisions? I'm confused about what it actually costs us and where this max cost per service comes from.
So the total cost column that shows each of the dollar amounts that correspond to each of the types of services, we are taking the total service cost and we are dividing that into the number of calls, essentially, the number of types of calls or types of services in order to get to that max cost per service. So it's not just dividing into the number of calls. There's also the aspect that we mentioned before of the number of apparatuses that respond to each call, the average time for each of those calls, and the number of staff that would be included on those apparatuses in order to ensure that the service is delivered up to standard, up to par.
So the max cost does reflect our full costs that Metro Fire is bearing, and that shows we're not making a profit, is what max
Exactly.
means.
Yes.
Okay.
You are not making a profit with max cost per service. The max cost means that is the highest that can be charged because it reflects the services that are being rendered.
Okay, and then I have two other kind of larger questions, close to what President Wood asked. Okay, on what does Medicare reimburse for? We had, I think it was earlier, the list of fees, 5 or something like that. What does Medicare reimburse on these tables?
So Medicare will cover transport. Medicare will cover the individual add-ons. It's just that there is a cap to how much Medicare will reimburse the district for the services rendered.
And is that at 30% of our max costs?
No, Medicare, so when I say 30% of your costs, what that means is that out of all of the dollars that are billed to patients, 30% of that is being recovered, 30% of that is being paid. Doesn't necessarily mean that it's 30% that Medicare is paying or 30% that Medicaid is paying. It's just across the board, that dollar amount that this district is seeing for the year is 30% recovery.
No, thank you for that clarification. What is the percentage that Medicare reimburses us?
That will depend on what type of Medicare, what type of Medicare coverage it is. Could be Medicare A, could be Medicare B. It differs.
Well, again, another follow-up perhaps offline, because I get very confused on that stuff. So how many different, there are four, A, B, C, D, E, for Medicare coverage, reimbursements?
I believe there are three different kinds. I can follow up with you on that.
Yeah, well, okay, thank you. And then I noticed that it's not just a disclaimer, but you, in your report, you said you didn't study any ways to increase fee collection. Is that anywhere in our future to help our staff with some ideas about how to increase that 30% recovery?
I think that's part of what we're doing today. What's the next step will be part of the guidance we give at the conclusion.
Right, for what we charge, but I'm wondering, is there any other emphasis or a political push or machinations within the healthcare industry about how to recover costs in a better way or more effective way?
What I can tell you, separate from this fee study, there was recently something called the Ground Ambulance Data Collection System. It was a Medicare report that all fire departments in the nation had to fill out over the last couple of years that would help Medicare, CMS in general, get a better idea of the true costs of providing ambulance or EMS-related services. So I do know that since something like that was recently requested and submitted, that there are discussions being had about how to increase, how to understand what to look for in terms of what are the true costs that providers are incurring so that you all could recover more of your costs.
And that ends up at the federal level, correct?
Yes, it does.
Okay, thank you, ma'am. Thank you, President.
Thank you, Director Jones. Director Clark, did you have comment? Yeah.
Yeah, my question was answered.
Okay. All right. Any others? No. All right. So Director Costa.
Sorry, not for yourself, for Dave. Sorry, Dave. So I think as President Wood said, this is really laying the groundwork for us to move to the next steps. And so I just wanted to highlight, we're talking about all these numbers, so max cost per service. So in the staff report, it does highlight our current fee and then what the proposed fee is, and in two categories, we'll be seeing a reduction in the fee. So I think it's important for our constituents to know that we're also looking at ways to reduce costs, which is covered in the staff report, so thank you. And then I just want to point out, I think in here, it does refer back to the night charge. So as Director Weber had highlighted, I think it'd be important for us to come back and talk through that a little bit more for why we have that in place and other options that might be there. But I want to just take the time to say that we are looking at these fees, and sometimes they're going down, which is a good thing. So we're going to see some reductions for the services we provide. So thank you.
Thank you very much. Good point, Director. Director Weber.
Dave, is the PPG EMT part of the study?
It is, yes, it is. It's part of the federal CMS funding.
Thank you.
All right, this was a presentation item. Thank you so much for all of it, and sorry to pull you up on the spot there, Chief Perryman. But thank you for coming up and giving us some answers. Is there some direction that the board wishes to give or comments we want to offer to staff on this? Is it the board's desire to have a revision to our fee study or our current fees come back?
Yes, I would like to see a new study.
We've got the study, but the revised fees? If that's kind of general consensus, you have, I guess, marching orders informally? Did you want to add something?
I was just going to say that, yeah, I think that we should try to align as much as possible the fees with the costs. And if the costs are changing, we need to adjust it accordingly. With MIH coming back next year, for example, as one example, And also, I need to get more educated on all the different lines so we can figure that out. So I would like to see it.
Director
Another
Weber?
question I have is, why are we only collecting 30%? I mean, we've talked about this with the other funds that are paying their arrears and everything else. I mean, that seems awfully low. So, why?
Go ahead,
Yeah.
you did answer it, yeah.
So when it comes to recovering fees for EMS-related services, there are usually caps or write-downs that end up occurring that prevent the agency from recovering the full cost of services rendered on the scene. Could be Medicaid-related, Medicare-related, it could be a private insurance-related, where there are caps based on what's included in the contracts for those services. Could also be that the person doesn't have insurance and maybe it becomes a complete write-off instead of a write-down. So that's another area.
So the private insurances also have caps?
Yeah, insurances, sure, they do. They're not as low as the like Medicare, Medicaid, but they also have caps.
Director Stark?
Just a thought about that is that some of these it's a political issue because these are different agencies that we're collecting from, some of them Medicare and Medi-Cal, which is the federal government, which they set a certain rate. As we've seen with trying to find psychologists and psychiatrists, they won't take Medicare because the rate is set too low. It's set at the federal level. And so that's something perhaps we need to lobby to get that level lifted so that we can get more recovery. So that's probably part of it.
Another quick question.
Director Jones?
Thank you. It's not so quick, but this idea of discussion ties in with what my fellow directors have mentioned. This idea of the 30%. Now, one question comes to mind. Do we bill the person if for overages above these caps?
No, I don't,
No.
that's not happening, correct?
No, we'll
Right,
just be billing based on the type of service that was provided.
right.
Wait, we bill the agency, we don't send it to an individual for the overage.
There were
overage?
prohibitions against balance billing in certain fields.
Certain fields.
Certain, like California is a state that has a prohibition against balance billing.
Balance billing, yeah.
So it's prohibited to,
If you accept the insurance money or the Medi-Cal,
okay.
you accept that money as full payment.
Thank you, Dr. Wood, I appreciate that. Very good, very good. But can we, when we revisit this, can we have some options for the, like,
So-
for example, I kind of, what Director Weber was saying about night calls kind of, I think we might share some of the same perspective on that. So we would want some options.
Yeah, so
down
if I
this
may, I hear you, Director Jones. And so just as an awareness, this is the first step in the process of going through and redoing our ambulance fee structure. This is just the initial step. The feedback you all are providing is going to inform us for exactly what you're talking about looks like. So thank you for the feedback. There's multiple more steps in this process, ultimately resulting in us adopting a new EMS fee structure to represent what we're currently offering services for. As an example, with SB 1180, that allowed us transport to alternative destinations, mobile integrated health and community paramedicine funding opportunities with Medicare and private insurance. That's why we're doing this, to be able to bring it up to the level that we need to, and also not rely on the current billing structure of when you call 911, you get an ambulance and you either go to the hospital or you don't. We all know it's different now. Right resource, right capability, right time, mobile integrated health, sobering centers, psychological services. This is all part of what we're talking about here to get to what right looks like. So this will be a multi-phase process, but please feel free to reach out with any other questions and input so we can get that moving forward.
I very much appreciate those comments, Chief Mitchell, because we need to take not drag it out, but we do need to do this step by step and fully investigate all the ramifications of costs and how to replenish those expenditures that we have to do. Thank you, Chief.
All right, any other comments, questions while they're here? Going once, going twice. Thanks so much. Appreciate all the time and energy you put into this.
Thank you.
Thank you. All right, moving on to our action items. Items 1, 2, and 3 are all going to be presented by Shay Purcell. Good evening, Shay.
Good evening, directors, Chief Mitchell, public, 1-2, never forget. 24 years ago today, Chief Mitchell and I were in the fire academy together. It was a banner moment. Any rate, first of these tonight for you guys is a purchase for 4 Type 3 engines. This one is going to mirror the CAL FIRE specification. Our neighbor to the south had the opportunity to buy these vehicles a year ago and then reneged on the purchase. They decided to go a different direction. We had the opportunity to capture those 4 vehicles at the cost that they were sold at a year ago and at the timelines that they would be built. So we knocked a year off the timeline, saved a little bit of money. These will be completed with the 4 sister units that we ordered also a year ago, so we'll get all of them at the same time in fall of 2027. And staff recommends that the board approves this purchase of 4 BME Type 3 engines from Golden State Fire at this time.
Do we have any questions on item number 1?
No, sir.
Nope. All right, well, thank you so much. I'll entertain a motion.
Second.
I'm
I
sorry.
heard Director Clark, and I heard Director Jones first.
Okay, great. Director Sailors.
Aye.
Director Stark.
Aye.
Director Clark.
Aye.
Director Jones.
Aye.
Director Weber. Director Costa.
Aye.
President Wood.
Aye,
Thank you. Motion passes.
thank you.
Excellent. On to number 2. This is for 2 rear mount aerials. The approved CIP plan for the next 3 years includes 3 aerials. This is for 2 of the 3, the rear mount units. The 3rd aerial, a tiller style, will come before the board in a future board meeting. We will be prepaying for these units to obtain a significant discount, in this case about $630,000, and to avoid cost increases over the next few years that happen 4 times a year for Pierce. Due to the number of units we're purchasing at one time, Pierce has reduced the lead time for us from 4 years to 3 years for these units, so another little perk. Staff recommends the board approves the purchase of 2 rear mount aerials from Golden State Fire Apparatus Incorporated at this time.
Before I give other questions, just wanted to get out there on the record. We're also getting a performance bond so that we're guaranteed that we will either get the apparatus or we will get our money back, correct?
Correct. No risk at all.
All right. Any questions or comments for Mr. Purcell? Nope. I'll entertain a motion.
I'd like to move it.
I'll second.
We got a motion and a second. Would you call the roll, please?
Yes. Director Sailors.
Aye.
Director Stark.
Aye.
Director Clark. Director Jones.
Aye.
Director Weber.
Aye.
Director Costa.
Aye.
President Wood.
Aye.
Thank you. Motion passes.
And finally, for the largest purchase I personally have ever made, 15 Type 1 engines at one time. This purchase includes 3 years of acquisitions, with 5 units per year being delivered starting in 2028. So from this point forward, once we hit that marker, every year for the length of the Measure O funding for 10 years, we'll be getting 5 engines a year into perpetuity there, and we'll back this out a little bit. We will also be prepaying for these units to obtain an even more significant discount, in this case, $2,736,000 and change, and also avoid cost increases that'll occur over the next 2 years. And again, due to the number of units we're purchasing, we're also getting these in 3 years instead of 4. And staff recommends that the board approves the purchase of the 15 Type 1 engines from Golden State Fire Apparatus at this time.
And once again, we do have a performance bond on these to guarantee
Absolutely.
our receipt of the engines or return of the money.
This isn't a new thing. We've done this in the past before. It just has to work out whether or not it's worth prepaying, and the delivery times, the extended lead times that happened over the last, since COVID, really kind of messed that up a little bit. If we get them in a year and a half and we're prepaying, then we're not carrying the debt for as long, but, so now it's a little rarer, but yes.
Key point we need to know is they're guaranteed.
Correct.
That's all we're asking for.
No, and it's great. It's amazing what we're doing. You said $2.7 million savings on these 15?
So between the aerials and the engines, we're looking at $3,366,193 and change.
So that would be about 4 engines?
Yes. Now, bear in mind, that's not pure, if we had not prepaid and invested that money and caught returns on it, it's something less than that. But from the initial hit, yes. And then every year, 4 times a year, Pierce increases its costs on a percentage basis. Some years it's 3 or 4%. In 22, it was 28%. So it's all over the place.
That's a CalPERS number.
That's a math error right there.
No, so that's excellent work and excellent job getting that savings. Appreciate all of that.
Yes, sir.
Any other comments or questions for Mr. Purcell? Take a motion.
I so move.
Second.
Got a motion and a second. Can we get the roll, please?
Yes. Director Sailors.
Aye.
Director Stark.
Aye.
Director Clark. Director Jones.
Aye.
Director Weber.
Aye.
Director Costa.
Aye.
President Wood.
Aye.
Thank you. Motion passes.
Thanks so much.
See you next
Appreciate
time.
all you do.
Good job.
All right, moving on to number 4, we've got a resolution to amend the capital improvement program. Our admin analyst, Aaron Castleberry, sorry. Good evening.
Good evening, everyone. I am here tonight to provide an overview of our amended capital improvement plan for fiscal year 25-26 through 29-30. As you know, back in June, you adopted our CIP for these years. And during the final budget process, we have the opportunity to review the approved CIP and make any necessary adjustments. So these adjustments generally fall in 2 categories: project revisions and cost revisions. So project revisions will reflect any projects that we thought we were not going to finish, but then we ended up finishing. That would be completed projects. On the flip side of that, new carryover projects, projects we thought we were going to finish and did not finish and needed to carry over into the next year. That would be new carryovers. Any added projects, I'll get to those later. And then any scope changes on projects. So whether that, for example, we had a roof that we were going to rehab, and it turns out it needed a full replacement instead of a rehab. So that's a scope change that results in a cost increase. So scope changes, added projects, new carryovers, and completed projects generally are what we see in project revisions. On the cost revision side, what we do is when we are preparing the preliminary CIP, we're using estimates for what we're going to be at year end. So at final budget, we reflect actual year end expenditures. So we'll make adjustments on projects that have carried over, namely construction projects that we had estimated were going to be at a certain expenditure level at the end of the year. We've updated those to reflect what the actual year-end expenditures were. Cost revisions for confirmed costs. So July 1, all of the managers in the district who have capital projects got going on those projects, and they now have confirmed costs, whether that's they've gotten the bid, they've issued the contract. So any changes to confirmed costs are reflected in this amended CIP. Also, any revised estimates based on new information. Those are also reflected. And then any deferred costs. Those are primarily due to, most of those are related to comms for vehicles. So based on vehicle delivery timelines, we've made some adjustments in when we want to purchase the vehicle comms. So we've deferred some of those costs. Another deferred cost is for projects maybe that we thought we were going to be able to get done this year, and turns out maybe there's more scoping that needs to go into that project, so we're going to delay it until next year until we have some additional information. So as a result of this review, the amended CIP actually recommends that the board authorize 55 projects instead of 46. On the left-hand side, you will see what was adopted in June. On the right-hand side in red is what the amended CIP reflects. So you can see 9 additional projects are being requested. We'll go through those shortly. Apparatus and equipment, we added 2 projects. We added 7 facility improvement projects, and those were the only changes related to projects. Similarly, costs. The adopted was $179.1 million total across 5 years for the approved projects, and that cost has actually gone down. We're going to talk about why we are seeing some of those savings, but I think Shay's presentation explains a good portion of that. So apparatus and equipment went down. Facility improvement had an increase due to the added projects. No changes in PPE. New construction went down slightly, I'll explain that, and land acquisition, no change. For this current fiscal year, 25-26, what the appropriation for this fiscal year is for those projects you'll see on the left-hand side was 109 million. That is actually reduced to 103 million. So we're actually seeing a net reduction in our planned expenditures in the CIP for fiscal year 25-26, and we'll go over those changes. Again, same as the last slide, changes in apparatus and equipment, facility improvements went up, and new construction went down. So, summary of changes. In total, we had a total of $913,000 worth of cost increases in projects that were either revised costs or revised cost estimates. We also had $687,000 of new carryover projects. These are projects that were previously budgeted in the prior fiscal year. They were not finished, so we're moving them over into this new fiscal year. Those costs are mostly offset by, obviously, unspent funds at the end of the last fiscal year. New projects we've added, $628,000. If you recall in my last presentation about the CIP, there were some projects that we were slightly unsure about whether they were or were not eligible for Measure O funding. We have received clarity on that, so we do have some additional projects recommended in this amended CIP. Those are reflected in the new projects, as well as a few projects that actually were sort of emergency projects that we started at the end of last fiscal year, mainly facility projects that we are now, because of the amount and they do qualify as a capital project, we are reflecting them in the CIP. They have already been started. On the flip side of that, we have a reduction of $2.7 million to reflect year-end actuals. That's primarily in our construction projects. So that means we spent $2.7 million more last year than we thought we were going to. That doesn't mean the project spent more. It just means that between fiscal years, we spent more last fiscal year, which means we have to spend less this fiscal year. Similarly, we've had $4.5 million in reductions due to revised cost and revised cost estimates. So Shays was the biggest. That was about $3.5 million in apparatus reductions. And then there were some other various ones. And then deferred costs, like I said, those were primarily vehicle comms, about $700,000. Those will be pushed to future fiscal years. So in total, we have a net reduction of $5.8 million in our CIP budget. So how does this look in our fund sources? Basically, no change. The spread is pretty much the same. So Measure O funding, you'll see on the left-hand side is what we adopted. So this is how much each fund was going to be paying into the capital improvement plan. As you know, the CIP is funded through a variety of fund sources, Measure O obviously being the largest, but there are several fund sources for our CIP. So generally speaking, the allocation that is made across the fund sources didn't really change that much. There were some increases in the general fund, some increases in the capital facilities fund slightly, increases in the development impact fee fund, so that is primarily related to our Vineyard Springs station. So we actually collected more in impact fees last year than we anticipated. So we are able to pay more of the Station 67 project out of that fund and less of it out of the Measure O fund because that project is actually split. The Lease Properties Fund previously was not contributing anything. We have one of the new carryover projects, like I mentioned, was the headquarters roof, which was going to be a rehab and will now be a replacement. So because we have half of the property leased, we spend some of that out of the Lease Properties Fund. The Measure O fund went down. The biggest reduction you can see there, that's primarily due to the apparatus cost savings. And then the Special Projects Fund, that is for our Zinfandel project, that went down. And again, that's just the distribution between the fiscal years. We spent more last fiscal year out of that fund, so we don't have to spend as much this year. We will be spending down that entire fund this year with that project. Yes?
Sorry, just a quick question for clarity. So on the amended side, the general fund, we're seeing a 0.7 increase.
Correct.
Can we just talk to the difference between that and Measure O again, please?
Sure.
We're seeing a reduction on the Measure O side.
Yeah, so some projects are not Measure O eligible. So we saw cost increases in several projects that were funded through the A fund instead of through the O fund. So that is what that change is. Yeah.
Thank you.
So Measure O, generally speaking, eligible costs for Measure O have to be capital costs. So anything that's not equipment or capital related cannot be paid with Measure O funds. So for example, let's say PPE, that's not considered a capital equipment. So some of our maintenance things, those are not considered capital investments.
Yeah. It's important for the clarification,
Yes.
just because, our constituents fund in Measure O and they may have a different interpretation of it. So I think it's important that you clarify. Thank you.
Yes,
We drain that down as we build the vineyard.
correct.
Will that build up as there's future development? And then provide funds for future firehouses out in the newly developing areas?
Yes.
So it's going to constantly go up and down?
Correct.
Okay.
And that has been typical. That happened with 68 as well. So we drained it, it built back up. Now we've been able to pay for vineyard with what it built back up. That's typically how it goes with the impact fee fund. That's actually it. So we do work diligently to ensure that our CIP reflects the most accurate information that we have at the time. And doing the final budget revision helps us to refine those costs. So our recommendation tonight is for this board to adopt the amended CIP. And I will take any other questions that you have.
Any questions for Ms. Castleberry? No? Do I have a motion?
I'll make the motion, please.
Second.
Got a motion and a second? We can
Great.
get the roll, please.
Director Saylors?
Aye.
Director Stark?
Aye.
Director Clark? Director Jones?
Aye.
Director Weber?
Aye.
Director Costa?
Aye.
President Wood?
Aye.
Thank you, motion passes.
Thank you so much.
Great work.
All right, next up, we have the final budget, 2025-2026, with our CFO, Dave O'Toole. Welcome back.
Thank you. Good evening again, President Wood, directors, Chief Mitchell, colleagues, members of the public. Here we go. I will be presenting the 25-26 final budget. And for memory's sake, the final budget is the modifications to the preliminary budget you adopted in June. So the changes you'll see are relatively small. But we will be comparing significantly to prior year, to 24-25, so you can see the actual changes year over year. For tonight, we've got a kind of a simple agenda. I'll give you a couple slides of overview of the budget, and then we'll talk about general fund revenues, expenditures, the capital outlay summary. I'll spend a couple slides on a long-term forecast, a 5-year forecast with the assumptions to go with it, and then I'll do a quick summary and questions, and then the resolutions, of course, too. So, 2 slides there. There we go. Final budget overview. So this is the slide I use to give a big picture of what the budget looks like. There's a section at the top in gray that's all funds, and the section in the blue is general fund. And I did provide 2 reference points to final, the prior year budget and preliminary, so you can kind of see how we hopped from one to the next. So the Measure O well, let's see. Starting with the gray area, the final budget revenues from all funds are $358.9 million. Expenditures are $457.5 million. So the expenditures really jumped up from prior year, and that's because of Measure O. Measure O expenditures are about Measure O expenditures contributed that significantly, but if you look at the other financing sources, that reflects mainly transfers in from fund balances. So it jumped from $8.3 million last year to $161.2 million in final budget. and that's mainly related to Measure O as well. Taken together, the increases for the balance of all funds, it increases to 62.6 million. So, and then moving down into the blue section, that's your general fund again. The final budget revenues climbed from 329 million last year to 341 million. Expenditures reached 341.7 million at final, as we expect. And the next row, the other financing sources, which is mainly the net of transfers in and out of the general fund, balances were reduced by 4.1 million. And those transfers are mainly out to capital facilities to pay for ongoing apparatus financing, or I should say carryover apparatus financing. And what that means, those numbers all tie together, is you do end up with a deficiency of 4.9 million. That is the amount that we expect to dip into the reserve by the end of the fiscal year. And if you look at the row below, the bottom two rows at the bottom there, you see the reserve balance is actually growing relative to the preliminary budget. The middle column there, when I presented it at 33.2, I'm now presenting 36.1. The reason for that is because of savings that we're able to recognize after July 1. The audit is not complete. We typically recognize everything in mid-year after the audit is complete in December, but we're able to look at it and recognize there's going to be significant savings, so we can recognize 3 million now, and that's why it jumped up from prelim to final. Let's see, but speaking to the reserve borrowing, 4.9 million, obviously, context and public you're aware of, we're not the only local agency going through this. I've mentioned before cities like Sacramento, the County of Sacramento, Oakland, San Francisco, all facing kind of difficult budget and dips into reserve this year. The chart to the right is new. I just wanted to show that. It's just a quick snapshot of over time. You're looking at 6 years there, where the blue line was revenues and net transfers in, and that was above the red line, which is expenditures. And you can see in the last 2 years, we've just tipped over. So the 24 column there, 24, 25 column there is where it just went over when we did all the reconciliations by the end of the fiscal year. Expenditures were still over, so that resulted in general fund reserve. And then you can see to the right, the red line's a little bit further above the blue line. That's where the 4.9 million would show up, if you see it graphically. So, next slide is a fund balance summary for all funds. So across the top are the 8 funds. And the gray line at the top there is your beginning balance. So that's what we had on July 1, 2025, so the end of the prior fiscal year. And then those unshaded rows are the activity in those funds, revenues, expenditures, other financing sources, the net change, and then the change in fund balance. So general fund, the numbers I just showed you, you can see that the change in fund balance is a negative 4.9. That's the amount that comes out of the reserve, and then reduces our ending fund balance down to 36.1. So it went from 41 to about 36.1, 4.9. Capital Facilities Fund, we don't keep a balance. We're not currently keeping a balance in there. We have some expenditures, but the transfers in will result in a balance of, end-of-year balance of about 667,000. The Leased Properties Fund, we have revenues coming in there. We expect to end the year at 2.8 million. Grants Fund, we expect to receive about 4 million during the year, expended all of the balance of 0 as expected. We want to spend what we receive in grants. Development impact fees was just mentioned. We have a balance about a little over 14 million right now, with the expenditures shown and just referenced in the prior presentation. We expect to have around 3 million at the end of the year, 2.9. The next 2 funds are Measure O related. So we have a debt service fund. We begin to pay off that debt service over 30-year lives of the bonds. And then the next is the amount we expect to spend, the 76.5 million in Measure O. And then the next column is Special Projects Fund. Again, we expect to spend that. On this, we have a balance about 150,000, but we'll update that at mid-year. So that is the big picture of all the funds. You can see all of your funds, the activities, what they started with, what happened, and how it finishes. So now getting to general fund, I had a couple of slides on revenues and expenditures. As noted there, so the projected general fund revenue is 340.9 million. That's 12 million over the prior year, the 3.6% increase. Property taxes were up to 224.9 million, which is almost 12 million over last year. In the charges for services category, we see EMS fees at 50.2 million, which is 3.2 million over last year. The public provider ground emergency medical transport program will be at 25.5, which is 1.3 million over last year. And then VRP, expect a modest increase, 333,000 to 16.5 million. CRD fees, expect to drop off slightly down to 6.4 million relative to last year. And then the net of just that last bullet there, a net of formerly IGT classified funds. We used to have an IGT fund where we put voluntary rate range program and PPGMT, move those into the general fund, but just for continuity, so you can see the net change in those is the net revenues would be 26.6 million, which is about $600,000 less than 24-25. So even though the revenues are going up a bit on those, the expenditure side, which is the amounts that we pay the Centers for Medicaid Services, CMS and Feds, or the State Department of Healthcare Services have gone up a little bit too. So that's a big picture of your revenues. On the expenditure side for general fund, again, the number is 341.8 million. We're at 18 million more than last year, a little under 6%. The labor budget's at 273.5 million, 6.6 million over last year, 2.4%. This was no change since preliminary, but just continued this next bullet here. So we did add 10 positions, including 6 firefighters effective in May. Let's see, a shop assistant, a helicopter mechanic, warehouse supervisor, and facilities tech. Labor costs will be about 80% of general fund revenues, which is down slightly from what I had at prelim. I think it was 80.4, 80.5, right around there. So with the adjustments this year, that since prelim, it's changed a little bit. Service and supplies, 63.2 million, which is an $11 million increase over prior year. A couple things making that up. There's I mentioned some savings. There were some savings in service and supplies where that was. So that goes into, so that reduces last year and it makes the increase look higher. So that's about 3 million of that. But the other balance of that, around 8 million, are several increases across the board. I have a slide coming up which lists some of the higher dollar changes to service and supplies as well. The labor portion of the expenditure budget, first for terminology, compensation includes your wages, incentives, paramedic, education, longevity, as well as overtime, constant staffing, out-of-class pay, sick and leave buybacks. That all falls in compensation. On the benefits side, that's your payments of PERS to SCRS, medical costs, that kind of thing. Between those two, so starting with the compensation portion of the page there, the top portion, 152.6 million. Wages were 5.4 million or 6.4% higher than last year. There is no, in this budget, there's no wage increase built into this fiscal year. Constant staffing is 6.5 million or 21.2% lower than last year. You can ask, why would that be? This is attributable to a change in how we're recognizing positions. So we're now recognizing not just all positions that aren't in the pool, but all positions that are in the pool as filled. And that results in a corresponding reduction to constant staffing. So our wages actually went up in part because of that methodology change. Let's see, incentive pays for EMT, paramedic, education, hazmat, and longevity are $1.5 million higher than last year. Moving on to benefits, the total benefits are $121 million, which is $5.2 million more than last year. Increased CalPERS contributions of $7.1 million, which is 11.6% increase over prior year. And the increased medical costs of $2.7 million. We did have a small decrease in workers' compensation costs of $252,000, just based on the trends that we saw last year. The general fund expenditure, service and supplies, I mentioned I would list out and tell you some of the larger dollar changes to that. One of them was again, the IGT payments to the state of California bumped up. We had to pay more to them to pull down PPGMT and voluntary rate range program, more expenses on education and training. Insurance premiums went up, liability and property. Let's see, vehicle maintenance services costs went up, more in computer and licensing, as I said, and then dispatch services went up by $645,000. There's just kind of a snapshot of some of the larger dollar ones. This next slide is capital outlay summary. So just tying a bit to the earlier presentation, total spending of $99.2 million. Approximately $74.1 million committed from the Measure O Building Fund. Note that the 99.2 million for total capital spending is slightly higher than the CIP plan because some capital projects don't qualify as CIP projects. So there's a little bit of, if you notice a discrepancy, that's why. Anything under 50,000 doesn't show up in CIP, but does show up in our capital outlay summary. Some of the major projects that I've listed out there: Station 67 build out, 9 million, 25 ambulance replacements, 9.2. We just did 15, also 15 Type 1 engine replacements, 15.8 million. We'll have 8 Type 3 engine replacements at 7.6 million, a dozer replacement. So some of this sounded familiar. And then also listing out some of the development impact fee funds spending for Grant Line 220, Station 67 as well, Zinfandel. And then that last special projects fund portion, we think, for phase 3 of the Zinfandel Training Center. So there's major capital outlay summary items listed in the budget. So moving on to the last sort of portion of the presentation is the long-term forecast. So I provide this every time we do final and preliminary budgets, but just a kind of a reminder, some of the assumptions that go into it. Let's see, we use the county's latest property tax reports through fiscal year 24-25, so through June 30th of 25. And our property tax consultant's most recent projections through 29-30. So, and then on the forecast also incorporates current wage costs adjusted annually to reflect natural growth, such as step increases annually. That's about 2% we typically see. Does not include any wage increases through the period of the forecast. Let's see, the most current PPG, MT, and VRP revenues are used with approximately 2% adjustment for growth. And pension costs are increased to CalPERS 5-year projections rate, so incorporated those into the pension costs. And annual CPI is 3.2% through the forecast period. It's kind of holding that flat. So one thing I do want to show you before I do get to the forecast slide is this. I think this is important. I recently came across this slide. We obviously property taxes are our number 1 generator of revenues for the department, and we do see property taxes go up. We have seen growth, 7%, 6% next year, or this year, 5.5%. But as you'll see in the forecast, that's starting to come down. In this slide, and if you follow the issues, if you follow the home sales closely, not just in this community, but across the country, the prices are starting to flat and the number of sales is going down. And that is why we're going to see a flattening of the rate of growth. I'm not talking about negative growth. I'm still talking about growth. It's just the rate of growth is flattening. But basically what this slide is showing you is that, let's see, the median home price shown at the blue line is $516,000 today. Back in January 2022, so this is just taking that period from January 2022, it was $520,000. So the median price has actually come down over that time period. The red line rose modestly from that's the average price, rose modestly from $555,000 to $581,000 today. Okay, so this is the forecast. So we're kind of straightforward slide. I'll just explain it. This is presents here 5 years. The blue columns are your ending general fund reserve balance. The red line across the top is what 15% would look like, or where that marker would be, and then general fund reserve ratio is that green line. You can kind of see that coming down. That ties to the numbers at the right there, the 15, 10%, 5, and 0% at the right of the slide. Some things to keep in mind: the 5-year forecast shows general fund reserve borrowing continuing, albeit at a lower level than this year. This projection includes $1.4 million in general fund borrowing in 26-27, $860,000 in 27-28, and $3.2 million in 28-29 before not being needed anymore under this projection. Oops, sorry, didn't want to press that. Sticking with this slide. Those numerically, those are in the size of a budget. It's $340 million, not enormous, can be closed, but it brings up those considerations of what's going to happen with revenues. What can we do about expenditures? So a couple of other, a couple of wild cards that we're watching closely is, we've talked about Medicaid a bit tonight, and the funding levels for that are still a concern. There weren't any immediate cuts in this, and the proposed federal budget to us, so we sidestepped that nicely. But it's still a possibility. On the positive side, also sticking with Medicaid and the PPGMT program specifically, we may see an annual increase like we saw last year in January, and this could generate $6 million. So that's makes a big difference for a forecast like this. Can really swing things and change the picture. But I put that out there as just some wild cards that we have to watch for, and when we're back at mid-year, we'll have better answer in both of those. Okay. So final budget summary. So just kind of highlights again. The general fund budget again requires a reserve transfer of $4.9 million. The general fund reserve declined from 11.3% in 24-25 to 10.5% in final budget. General fund growth 3.6% next year, while expenditures are 5.6%. 5-year forecast shows modest reserve borrowing will continue, subject to significant changes in property tax trends and labor costs. And then Measure O will provide substantial relief in the capital projects backlog with $74.1 million committed in 25-26. So that concludes my presentation, and subject to your questions, my recommendation is to approve the resolutions.
Thank you very much for the detail. Do I have questions from my colleagues? No? You covered it all. Thanks so much. We can go through these. We have to take these individually, as you're all familiar with that requirement. So if somebody wants to start off with a recommendation for item 5A.
I'll move it.
Second.
Got a motion and a second. Can we get the?
Okay. Yes. Director Sailors.
Aye.
Director Stark.
Aye.
Director Clark. Director Jones.
Aye.
Director Weber.
Aye.
Director Costa.
Aye.
President Wood.
Aye.
Motion passes. Thank you.
I'll move the next one.
Well, yeah, moving on to 5B, Capital Facilities Fund 212D. Can I get a motion?
Mr. Chair, I move 212D resolution.
Second.
Can we get the roll, please?
Director Sailors.
Aye.
Director Stark.
Aye.
Director Clark. Director Jones.
Aye.
Director Weber.
Aye.
Director Costa.
Aye.
President Wood.
Aye.
Thank you. Motion passes.
Mr. Chair, I move C resolution for 212E fund.
Second.
Can we get the roll, please?
Director Sailors.
Aye.
Director Stark.
Aye.
Director Clark. Director Jones.
Aye.
Director Weber.
Aye.
Director Costa.
Aye.
President Wood.
Aye.
Motion passes. Thank you.
Okay, I move grants fund 212G.
Second.
We'll take the roll. Director Sailors.
Aye.
Director Stark.
Aye.
Director Clark. Director Jones.
Aye.
Director Weber.
Aye.
Director Costa.
Aye.
President Wood.
Aye.
Motion passes.
Mr. Chair, I move development impact fees fund.
Second.
I'll do the
Can we
roll.
get the roll, please?
Director Sailors.
Aye.
Director Stark.
Aye.
Director Clark. Director Jones.
Aye.
Director Weber.
Aye.
Director Costa.
Aye.
President Wood.
Aye.
Motion passes. Thank you.
Mr. President, I move lease properties fund 212L.
Second.
Can we get the roll, please?
Yes. Director Sailors.
Aye.
Director Stark.
Aye.
Director Clark. Director Jones.
Aye.
Director Weber.
Aye.
Director Costa.
Aye.
President Wood.
Aye.
Motion passes. Thank you.
Mr. Chair, I move Measure O debt service fund 212N.
Second.
Got a motion and a second. Can we get the roll, please?
Yes. Director Sailors.
Aye.
Director Stark.
Aye.
Director Clark. Director Jones.
Aye.
Director Weber.
Aye.
Director Costa.
Aye.
President Wood.
Aye.
Motion passes. Thank you.
Mr. Chair, I move Measure O building fund 2120.
Second.
Can we get the roll, please?
Yes. Sailors.
Aye.
Director Stark.
Aye.
Director Clark. Director Jones.
Aye.
Director Weber.
Aye.
Director Costa.
Aye.
President Wood. Motion passes. Thank you.
Mr. Chair, I move special projects fund 212S.
Second.
Can we get the roll, please?
Yes. Director Sailors.
Aye.
Director Stark.
Aye.
Director Clark. Director Jones.
Aye.
Director Weber.
Aye.
Director Costa.
Aye.
President Wood.
Aye.
Thank you. Motion passes.
Thank you so
Congratulations, Dave.
And thank you. Appreciate all the patience going through that. We have to go through that one at a time. It's a lot of work, a lot of repetition, but. All right, we're moving on to item number 6. This is, came up recently with the, some conversations we've had with the city of Folsom. And for point of background, Chief Mitchell has offered to pick up that oar for me, so thank you.
Thanks, President Wood. Yeah, as Chief House mentioned last time in his fire chief's report, there was an initial meeting between a city manager from City of Folsom and himself to discuss some potential for fire services and what that might look like in the future. The recommendation out of that meeting was to develop an ad hoc committee, a 2x2 committee that will serve in an advisory and exploratory capacity only. It will consist of 2 members from the city council, from the city of Folsom, and 2 from our board. The intent is to assess the existing fire service delivery models in both agencies and look at opportunities for any collaboration or integration, review the fiscal, operational, and governance implications of potential partnership models, and then provide the periodic updates back to the full city council, City of Folsom, and the Sac Metro Fire Board. The Folsom City Council did take this up as an action item at their last meeting on the 9th and appointed 2 members from their city council to participate in this committee. And tonight, President Wood asking for recommendation from the board on what that might look like for us. Any questions, I'll be happy to answer.
Yeah, do you have questions for the chief on the history of the background? No? I have taken, I've spoken with a couple of board members who wanted to do it, and Grant Gould, and Director Jones have both expressed an interest in doing this and willing to take on this role. So I would nominate the 2 of them. If anyone cares to second that, we can.
We all would. We all would.
We have a motion by President Wood and a second by Director Clark. Would you like me to take the roll?
Please, thank you.
Yes. Director Sailors.
Aye.
Director Stark.
Aye.
Director Clark. Director Jones.
Aye.
Director Weber.
Aye.
Director Costa.
Aye.
President Wood.
Aye.
Thank you. Motion passes.
Appreciate you stepping up for that, Director Gould and also Director Jones. Item number 7, action item number 7, we will take after closed session, so we'll move on to reports. President's report, I have nothing to report. Fire Chief.
Yes, good evening again, President Wood, thank you. Directors, colleagues, members of the public, good evening. Adam Mitchell, Acting Fire Chief for Chief House. A couple items to update you on. We had a Station 111 open house and Old Betsy's 100th anniversary on September 6th, which you heard about earlier in public comment. Thanks, Roger. It was well attended. It was hosted by the crew there. We appreciate their dedication to getting the station ready, as well as recognizing the 100th anniversary of Old Betsy. Thanks again to all the staff who assisted with the planning, logistics, and of the staffing of the event, as well as to all of those in the community that attended. It was awesome to recognize the milestone of that engine at 100 years. So thanks for all the work that went into it. Secondly, we have a Metro Fire MMP Academy 25-2 that will be in class on Monday, September 15th. And as of yesterday, or 2 days ago, there were 16 recruits that will begin that academy, and we welcome them and we look forward to them and supporting their success as they begin their academy and future, being future members of the agency. And then this morning and throughout today, a number of members participated in the 9/11 Memorial Stair Climb, and I see a few of them in the audience. I'm sure their calves are a little sore, but it was well attended. It was a great job to be down there and recognize their participation. A lot of firefighters and community members in honoring the lives of those lost in downtown. We also had many remembrance events across our community we participated in, reflecting our continued commitment to never forget. And both operations and professional staff represented the district with a lot of professionalism and respect, and we thank them for their dedication on this day. And on that note, on today, which is the 24th anniversary, we want to take a moment to reflect and honor the lives of those lost on September 11th, 2001. This day is forever etched in our hearts, not only as Americans, but especially as members of the fire service, where the legacy of bravery and sacrifice is deeply cherished. We proudly carry forward the memory of those 343 FDNY firefighters who selflessly gave their lives that day, along with the countless first responders and civilians whose courageous actions continue to inspire us. September 11th serves as a poignant reminder of the true purpose and calling of our profession, is to safeguard lives, even in the face of significant personal risk. While the tragedies of that day took place 3,000 miles away from here, Metro Fire members were among those who answered the call and deployed to assist in recovery efforts at the World Trade Center and the Pentagon following the attacks, in addition to our partner agencies in the community. They dedicated countless hours over many days working alongside other first responders under challenging conditions to conduct search and rescue missions. Their expertise was vital as they navigated debris and faced hazardous environments, demonstrating remarkable resilience and determination. The spirit of solidarity among first responders, including Metro Fire, exemplified the true essence of service and sacrifice during these trying times. For those of us in the fire service, this day inspires us to never forget and to continuously train, prepare, and serve with unwavering dedication. While September 11th was undoubtedly a tragedy, it also ignited a profound sense of national unity. Communities rallied together, neighbors supported one another, and our country found strength and solidarity. Today, as Metro Fire, we honor that spirit by fostering trust, resilience, and partnerships within our own community. The impact of 9/11 continues to affect many, as numerous first responders and survivors face ongoing health challenges related to their service at Ground Zero. We stand with them and honor their sacrifices. On this solemn anniversary, we reaffirm our commitment to our core values of integrity, professionalism, teamwork, and devotion to duty. We will always remember those that we lost, the families whose lives were altered, and the enduring examples of bravery that continue to guide us. So let us carry our mission to serve our community with pride and respect, honoring the incredible sacrifices that were made. And if you would entertain it, President Wood, I would like to request a moment of silence at the conclusion of our board member comments before adjourning to closed session.
I appreciate that. Thank you so much for the report, Chief, and we will definitely have that moment of silence. Thank you. So we'll move on to the operations report. Assistant Chief Rudnicki, good evening.
President Wood, directors, Chief Mitchell, colleagues, John Rudnicki, Assistant Chief C Shift Commander. It's my privilege to be here tonight. The 9/11 stair climb today was remarkable, and it's one of those events that our members on duty want to attend, and we support them. We had quite a few of them there today, on and off duty. But one of the interesting stats, we talk about 343 firefighters lost their lives, but just today I saw a news article and a stat that according to the World Trade Center Health Program, over 34,000 individuals has been diagnosed with 9/11 related cancer, which is another staggering number, and one that reminds me when we talk a lot about mental health and all the things that we deal with is not just responding to those emergencies, but what we take home with us from those emergencies. It's an honor and privilege to serve, but it's one of those reminders that they do have lasting and lingering effects. On another note, deployments. I'm proud to report that we've been able to support the state and our neighbors when they need our assistance. And because of the men and women and the staffing that we have and ensuring and prioritizing not having brownouts and keeping a close eye on how many mandatories we have, we've been fortunate enough to deploy more resources this year than we have in recent past, to include strike team leaders, trainees, REM teams, fire line medics. We had a mechanic go out, various overhead assignments, including a safety officer. And though these positions are crucial and provide support operationally, it also is something that we need within our agency for increased training, awareness, exposure, and mentorship for the future. So that's great for us. And so now the highlight of my report is my opportunity to introduce Captain Tucker Hodge. And Captain Hodge is at Station 65. Before I turn the mic over to first his battalion chief, John Graff, and then Captain Hodge, I want to just share the highlights of these moments when our members promote was the opportunity to stand there at Station 65 with Captain Hodge and his wife and his daughter and his extended family members, and to see the pride that they'll have in him and the energy and sacrifices he's made. And that promotion and this opportunity for him is not just for Captain Hodge. It represents his family and the sacrifices they make and the time that that they're a part. And so it really was a highlight and an honor to be part of that day. So without further ado, I'd like to introduce Chief John Graff to share a few words.
Good evening, Board. Chief Mitchell, John Graff, Battalion 14C Shift. It's just my great honor and privilege to announce Tucker Hodge. He came to Metro Fire as an MMP or single role back in the day, so great success story. And through his hard work and dedication, he's taken on the workload and perseverance to test, and it's a pretty steep competition, as we all know, through the promotional process. But happy to announce that late last month he was promoted to captain. He was pinned a badge earlier this month, and just proud to make that announcement. So he's serving in Battalion 14, Engine 65C. So Tucker, just a few words on your history.
Good evening, Board. As you heard, I'm Tucker Hodge, Engine 65 Captain on C Shift. First of all, I want to thank you so much for this opportunity. As it was brought out, it's an immense moment of pride for me and for my family. Being able to wear these patches and represent Metro Fire and wear this badge is a huge honor for me, and to be part of this organization. It's surreal for me being here now, starting out as a single role, as it was called back then, and seeing where I am now almost 10 years later. Being able to come up here and talk about the productivity that Metro Fire has accomplished and where we've gone in those years, and coming from leaving a full-time fire department and coming here to Metro Fire because I knew what I wanted to do and to come here. And so with that being said, I'm very thankful for this opportunity. My family is extremely thankful and very proud that they get to also represent Metro Fire. And I look forward to where we go from here with the MMP program being brought in that way and being introduced to Metro Fire in that aspect. I'm very excited to hear of the MMP Academy that's coming up and the members that we have going. So I continue to hope that we can provide the support that we can for those members. And being at Engine 65, we have a MMP there with them. And so I'm able to pay that forward and being able to give them the tools and everything that they need to be successful here. And so once again, I just want to thank you.
Thank you so much, Captain.
Congratulations.
Director Weber?
Congratulations, Captain. We don't see many of the ribbons, and so I know they're very special. Can you explain what yours is?
Yeah, so this ribbon was for a rescue we had over 3 years ago now on Engine 42. We had a barricaded subject in an apartment complex, and the decision was made to breach into that apartment complex utilizing the vacant apartment next door, cutting a hole through the wall with the saws that we had, going in there, making a successful grab of both victims that were involved, one of those being just a 2-year-old, which definitely hits home for me now, having a 2-year-old of my own. And so that's what this ribbon was for, and I appreciate that opportunity. If it wasn't for who we are as Metro Fire and the aggressive tactics that we employ, we risk a lot to save a lot, and I'm grateful that this department has given us and empowered us to make those decisions, and also to recognize when those members do make those positive decisions and see those good outcomes.
I remember that call. Again, congratulations and thank you.
Any other comments or questions for the captain?
Captain has a bright future.
Yep. Thank you very much.
Thank you.
All right, moving on. We have no administrative report, and we have no support services report. I have no report. Whoop, sorry. Skipped you again, Captain Scholar. 522. Welcome. That's 2 weeks in a row.
Walking slow.
Take your time.
Good evening, Board of Directors, Chief Mitchell, colleagues, members of the public, additional staff. Sean Scollard, Vice President, Local 522. First off, congratulations to Tucker Hodge. He's going to be a great captain. We've gotten to know each other over the years, and super excited for you, man. I think all of us would love to have a captain like you on our station, so congrats. I had the honor and privilege of joining 342 of my colleagues today doing the 9/11 Memorial Stair Climb as you could probably tell from the gate walking up here. It's definitely kicking in. But great event, echo exactly what Chief Mitchell said. You know, a day of remembrance. Crazy to think 24 years ago today that that event took place. And I think Chaplain Snyder said, you know, probably many of the folks that participated in the climb today weren't even born or probably in diapers. And, you know, the fact that they're still able to get out of there shows that we really do have a special culture in the fire service, that just because somebody wasn't actively involved or can remember that they can still show up and show the support and the memory of those 343 firefighters doesn't die in vain. I think it's important too just to recognize the 2,977 total folks, Americans that died that day as well. So as much as we like to remember the 343, our job is exactly that. We're public servants and we do everything that we can to protect civilians. And I'm sure that the FDNY and all fire departments across the nation hold that near and dear to their heart, you know, to also remember those that we couldn't save that day. It's a wonderful event every year. What was really exciting this year, and I talked to a lot of the guys, I don't want to age myself and say, you know, the older group, because I definitely still feel like I'm young, that there were so many new faces. I shook hands and got to talk with so many people that it was their very first year in the fire service, from agencies all over the place. Metro Fire had a phenomenal showing. We've really stepped it up, and Sac City, a lot of the regional agencies, they're, you know, CAL FIRE, Bay Area departments, a lot of Northern California, but it's been a fantastic event, I think since 2009, so it's the 16th year doing this, and it just seems to get better and better each year. The support from the community out there, thank you to all of them, the 6 that are watching this tonight, hopefully. But the community support out there is just fantastic. You know, opening up the doorways, giving us some encouragement as we're taking those relentless steps up and down the towers to get up there. It's just a great showing of support from the members of public and those that are currently in the fire service. So thank you to everybody in the room that was in attendance today. And yeah, I would just ask to keep in mind the total, the 2,977 that lost their lives that day when we take that moment of silence. So thank you.
Any other comments or questions, Captain?
Thank you.
So much. All right, moving on to committee and delegate reports. Now I'll tell you that we have no executive committee report. Chief Eureka, Comm Center, JPA, good evening.
President Wood, board members, Chief Mitchell, colleagues and guests. Joe Furica, Deputy Chief of Administration with the Comm Center JPA report. The Comm Center JPA board last met 2 days ago on the 9th. During that meeting, the board, I guess I should write my notes better. The board appointed Assistant Chief Matt McGee from Folsom Fire and myself as the board or as the chair and the vice chair of the board over there. So new positions for us. We've seen a great amount of turnover on that board recently, so it's a very young group of folks on that board. Also during that meeting, staff over there presented Metro Fire with a token of appreciation for allowing the Comm Center board meetings to be held in these chambers for over 2 decades. So I just wanted to show that to you very quickly.
Yeah, that's
Yep,
nice.
so that's very nice, and I'm sure it'll get displayed. Our next meeting is scheduled for September 23rd. And unless you have any questions, that's the end of my report.
Do you have any questions for Chief Eureka? Thank you so much, appreciate that.
Thank you.
Moving on, Finance and Audit Committee, Director Jones.
Okay, we're up. Finance Audit Committee, our next meeting is September 25th, 5:30 in these chambers. Come one, come all.
All right. Policy Committee, Director Costa.
Thank you. The Policy Committee met today. We heard revisions to the workplace violence policy and move forward to the full board. The next meeting is scheduled for October 9th.
Thank you. Moving on to board member comments and questions. We'll start with, to my right, with Director Sailors.
Thank you, Chair. I would just like to extend a great thank you to Station 111 for hosting the open house for Old Betsy's 100-year plaque. And it was a great event, attended by many. And since today is 9/11, it is a great day of remembrance. Thank you to everyone who did the stair walk and for our moment of silence. And that's all I have for tonight. Thank you.
Thank you, Director Sailors. Director Jones?
I was going to say no comment, but I wanted to share one report, again, in remembrance of 9/11. A report I heard on the radio this morning is that there's still a lot of work to be done. 30% of the victims have still not been identified through the DNA, and we've made great strides over the last 20 years with analysis and identification, but that's some of the work that still remains to be done.
Thank you. Director Stark?
I'm contained.
Director Clark?
No comment. Thank you, Mr. Chair.
Director Weber?
No comment.
Director Costa?
No comments.
And I will also echo the comments that were made earlier, and I just want to say thank you to the crew and everyone that helped make the open house at 111 such a great success. We've talked a lot about Captain Nunez, but there's a lot of other people that went into making that work. All of our CERT team members, Chief Nygren and her staff were there. So there's a lot of people that deserve thanks for all the work they put into that open house. And beyond that, we're going to go into closed session now to address item 7 and the items listed in the agenda. Our next meeting will be September 25th. If we could stand and take a moment of silence for the victims of 9/11. We're adjourned.
Recording stopped. Progress.
All right, welcome back. Can we get a report out from closed session, please, Mr. Labra?
Yes, thank you, President Wood. The board met in closed session pursuant to the closed session agenda. On item number 1, the workers' compensation matter involving Carl Jewell, the board unanimously voted to approve the workers' compensation claim of Mr. Jewell. On item number 2, the industrial disability retirement claim of Michael Lozano, the board took no reportable action. It will be revisited in open session. Item number 3, conference with legal counsel considering the government code section 910 claim involving Bradley Sweatland and Sacramento Fire District. The board voted unanimously to instruct the clerk of the district to return the claim as untimely per the provisions of the California Government Code. Thank you.
All right. Our only remaining piece of business today is to vote on the IDR for Chief Lozano. Do I have a motion on that matter?
Make the motion, please.
And that's a motion to adopt staff's recommendation?
Yes, sir.
All right. And we got a second from Director Jones? If we can get the roll, please.
Yes, Director Sailors.
Aye.
Director Stark.
Aye.
Director Clark. Aye. Director Jones.
Aye.
Director Weber.
Aye.
Director Costa.
Aye.
President Wood.
Aye.
Thank you. Motion passes.
All right. Thank you all. We'll see you here on September 25th at 6 o'clock. We're adjourned till then.
Recording stopped.